Hello, I'm Dr. Pamela Ruig. I hold the David J. Ellis Chair in Large Animal Clinical Sciences at Michigan State University. And in this video, I'll be talking about an important key performance indicator. And that's one that we all use as a reference, the bulk tank somatic cell count. Now, the bulk tank somatic cell count is often the first thing we'll look at to determine if we're developing a problem with mastitis. But there's a few important things to understand about how to interpret it. First of all, we have to remember that the bulk tank somatic cell count measures the quality of the milk that is sold, but it doesn't contain the milk from all of the cows. Just think about that for a minute. The milk that's in the bulk tank or in the tanker load of milk leaving the farm contains milk from cows that are healthy enough to contribute milk. So milk from cows that are treated with antibiotics isn't included. Milk from cows that's abnormal, cows with clinical mastitis, isn't included. And then in herds that are large and ship multiple tanker loads of milk per day, not every group is in every tanker load. And often there's a high somatic cell count group that may be segregated and contribute only to one load. So the bulk tank somatic cell count is not always reflective of the amount of mastitis in the entire herd. It may only reflect the amount of subclinical mastitis or somatic cells in a segment of the herd. It's also important to recognize that the bulk tank somatic cell count in very large herds that have more than maybe 1,000 cows, is often very low, even if we've got a considerable proportion of the herd that has subclinical mastitis and elevated somatic cells. So we always have to interpret the bulk tank somatic cell count relative to herd size and other factors that influence it. One of the most important factors that will influence the bulk tank somatic cell count is season. National data is very repeatable. Virtually every summer or wherever you're at, when it gets warm, the bulk tank somatic cell count rises, and sometimes it rises by almost 100,000. The reason the bulk tank somatic cell count goes up in the summer is because more cows develop subclinical mastitis. They develop more subclinical mastitis simply because warm, wet weather results in increased exposure to bacteria because they grow better. And secondly, when it's hot, the immune system of cows isn't quite as effective. So they tend to develop more infections than they would during the cool seasons. Now, the bulk tank somatic cell count is a reference for the milk quality, and we use it to determine if we should be concerned about the development of subclinical mastitis in a herd. And over the years, our guidelines and our criteria for what a good bulk tank somatic cell count is has gotten more and more stringent. Over the last 20-25 years, the bulk tank somatic cell count from herds that are in our top 6 milk-producing states has declined from almost 300,000 to well under 200,000. So today our criteria for what our expectations are for bulk tank somatic cell count are much more stringent. Most herds should be able to consistently maintain a bulk tank somatic cell count under 200,000. When the bulk tank somatic cell count does go up, there's a simple reason, and that is typically because more cows in the herd have developed subclinical mastitis. When we've looked at data on bulk tank somatic cell count and compared it to the percentage of animals within those herds that are above our cut point of 200,000, we've shown that about 60% of the variation in bulk tank somatic cell count can be explained by the percentage of the herd that's above 200,000. In other words, when we have more cows that have subclinical mastitis, that bulk tank somatic cell count goes up. Interestingly enough, that same relationship doesn't apply to the amount of clinical mastitis in the herd. And there's a logical reason for that. When cows have clinical mastitis, that milk doesn't go in the bulk tank. So a very small amount, less than 5% of the variation in bulk tank somatic cell count is explained by clinical mastitis. And that means herds can have a low bulk tank somatic cell count and have a mastitis problem with clinical cases. So you need to be collecting data on both. Another important factor that will influence the bulk tank somatic cell count is the percentage of the cows that are subclinically infected in a chronic manner. And we would define that as animals that have 2 or more months where their individual cow somatic cell count is over 200,000. In fact, that's one of the strongest predictors of increased bulk tank cell count. So if your bulk tank cell count is going up, if you're concerned about it, one of the most important things you can do is identify the chronically infected cows. All right, let's recap. The bulk tank somatic cell count is a very important indicator of milk quality, and it reflects the amount of subclinical mastitis in the herd. The bulk tank somatic cell count should be less than 200,000 cells per mil, and in many areas we should be less than 150,000 cells per mil. It will vary by season, but it does reflect the prevalence of subclinical mastitis. And it's not strongly related to the amount of clinical mastitis. So if you're developing a bulk tank somatic cell count problem, if your value is going higher than what you're comfortable with, I would encourage you to make sure you review your individual cow monthly somatic cell count values to start troubleshooting that problem.